First, we have to compare with large cities because the main problem is in Montreal. So it's true that it's worse in Montreal than in Toronto, but it's a lot worse in New York than in Montreal. It's worse in Paris, in London, in Madrid. It's worse than in Montreal. So there are many reasons for that, but mainly it's because of the people at the beginning who travel or didn't travel and in which countries they travel.
That's the case. In fact, you must look at different factors. Okay, first of all, there is the timing. As I was going to express, in BC, it was cases coming from China. The airplanes from China stops, so the transmission exposition was not as it was in Quebec. If we look at that's the situation of big cities, which are different. If you go to Alberta or small provinces, there is less people, less transmission and everything, and probably less traveling or airports coming from the international. We in Quebec go a lot to France, go a lot to Italy, where there was at that timing probably more people came back with this. And we had the proximity with New York, which is very important. We know that the epidemic in New York just came into Montreal and to Boisbriand communities soon. So this is part of a kind of exposition that probably haven't been done in BC, Alberta, or elsewhere. And we have the specific problem of our CHSLDs. I think it will be interesting to compare which are the volumes of people in CHSLDs in Ontario comparing to Quebec. What are the ratios of personnel? Were they staffed better than we were? That's all kinds of situations that will tell us. And there is this, I would say, virus, very bad one that infect you, and you have no symptoms and can transmit it. So this is the same for other provinces too, but this is part of the equation why this is happening. But I think it will be. We are still having hypotheses. It will be interesting to after really look at the facts, because in fact what was applied in the field, even if there is a recommendation for the provincial, it's always something to look at. So I think those analyses are going to be, I'm sure, done and looked at.
And it's not clear also the number of people dying in long-term residences. Are they declared the same way everywhere in the world? It's not clear. And we know that in Quebec we test them, or by epidemiologist references we declare all of them. Is it the case everywhere else?
No. Somewhere it's only a lab confirmed case. And sometimes they don't do a lot of tests, so they could not confirm that case. And we have this specific situation of what is considered probable elsewhere. Here it's confirmed. It's like if I'm the spouse of a person who died from COVID-19, I've got the same syndrome and I die. Even if I'm not tested, they're going to be counted as a case. So that can influence at least one part of the difference between the province of Quebec and others. And here in Canada,